Sino yung mga pasyente ko nga pala dito? One? Only one? Ikaw lang yung dumating out of the many?
Five.
Sige. Anyway, you might be wondering how come a surgical oncologist or a doctor like me is joining direct selling. I'm already quite successful in my direct practice, but I'm here for the product. Actually, I believe in the product, that's why I'm here. No? Kung successful ako, bakit ako magdi-direct selling? Mas malaki yung kinikita ko sa pagiging doktor ko. I joined this company, it's because of, not probably of the added income, that's just secondary for me. I'm here to tell you what my experience are, with regards to transfer factor. Kaya ako naging lecturer. Okay. So, I'm here to discuss the evidence base. We doctors always believe that there's always evidence. Dapat may ebidensya bago namin i-prescribe into our prescription form. So, ito yung isi-share ko sa inyo. Sa pagiging doctor ko, my specialty is oncology, surgical oncology. So I treat cancer most of the time, cancer patients. And the primary treatment for cancer is really tatanggalin mo. The mother tumor has to go. And if merong anak-anak, we call it metastasis, we treat it with chemotherapy. As you know, chemotherapy, daghan side effect ba? Unsang side effect sa chemotherapy? Tanggal ang buhok. Hair loss is one. Bakit may hair loss? Welcome, please come in. Dito, makante pa to dito. Ayan. Francis, mas mahal ang bayan dito sa Francis, ha? Sige, welcome. You're just on time kasi kaka-start lang. So I was discussing about cancer treatment. Primary treatment is always extirpation of the primary tumor, which is surgery. And chemotherapy is just the added treatment. Kasi ang cancer magdudaga, kalat na, nag-anak-anak. We can remove the mother tumor by surgery, pero yung mga anak-anak niya, hindi man namin kaya operahan yan isa-isa yung mga anak-anak niya. We treat it with chemotherapy. Ini-inject yun dito sa ugat. Pag punta sa buong system, you get all the side effect of chemotherapy. Hair loss, vomiting, pati yung mga red blood cell, white blood cell, bagsak lahat yan. Because chemotherapy acts on everything. Lahat pinapatay niya. Good cells and bad cells. But with my experience dito sa transfer factor, ang mga good cells na pro-protectan. One of the dreaded side effect of chemotherapy is my febrile neutropenia. You know what is febrile neutropenia? Febrile, ibig sabihin may fever. Neutropenia, ibig sabihin ng neutropenia, bagsak yung WBC. Kaya before chemotherapy, ginagawa namin ng CBC, complete blood count. Hi, good afternoon. Please take your seat, madam. You're always present here every time I have a lecture. How many are second timers, third timers? Memorize yun na yung aking lecture eh. Wala nang suspense eh. No? Anyway, welcome pa rin. I hope you can master my lecture so that you can cascade it to your downlines, no? The next time around, ako na lang uupo dyan, makikinig na ako sa inyo, okay? Several times na kayo nandito eh. So as I've said, chemotherapy, one of the dreaded side effect, which is nakakamatay, febrile neutropenia. May fever, ibig sabihin may infection, the neutropenia, bagsak yung WBC. Kasi pinapatay niya lahat ng cells, pati good cells, bagsak. That's why WBC goes down. If you have infection and your WBC, which is a soldier of our body against infection, is down, unsa na lang yung protection sa lawas against infection? Wala. That's why makapatay sa pasyente sometimes during chemotherapy. You know the famous actor, rapper, Francis Magalona, si leukemia last time, di ba? Kinamatay niya hindi leukemia. He died from the side effect of chemotherapy, which is pneumonia. Pneumonia is infection of the lungs. Kaya bagsak yung WBC niya. Wala siyang protection, kaya he died from sepsis. But with my experience, I'm going to share with transfer factor, very nil or very minimal na yung pasyente ko ay nagkaka-febrile neutropenia. 2 years ago, before my knowledge of transfer factor, medyo I should admit I have quite a few patients who had febrile neutropenia. Even 1 or 2 patients died from it. I have to admit that. Because of febrile neutropenia. But now with transfer factor, nil or very, very nil yun na nagkaka-febrile neutropenia. You know, pag nagkaka-febrile neutropenia during chemotherapy, anong binibigay ko? We give injection of filgrastim. Filgrastim is GCSF, granulocyte colony stimulating factor, GCSF. Per injection, that's almost 6,000 pesos para tumaas yung WBC. We give it every day for 3 days. 6,000, 6,000, 6,000. How much is that? 18,000. Then we give antibiotic 2,000 3 times a day. 2,000, 2,000, 2,000, 6,000 times 3 days. 18. 18 plus 18, 36 na. Wala pa yung professional fee ko. Wala pa yung hospital room rate. So kulang-kulang 50,000 every time you have fever during chemotherapy. That's why I explain to the patient, sige ka, if you don't take transfer factor and then you have fever during chemotherapy, then we do CBC, bagsak yung WBC mo, yung febrile neutropenia, that's what I will give and you spend 50,000. Ano gusto mo? You spend 50,000 or you just spend 3,000 plus 1 bottle a month and you're safe with it. That's why it's easy for me to convince my chemotherapy patient to take transfer factor. Kasi that's what my experience is. Okay. If chemotherapy is added treatment, adjuvant, we also give radiotherapy. Sometimes we do surgery, there are microscopic cells na naiwan, radiotherapy is the option there to prevent recurrence. And of course, best of all is the miracle of prayer. And now my latest armamentarium in the treatment of cancer is immune therapy. I believe there's a role for natural healing within your body. You yourself can treat cancer. Your body. Why is it that this person doesn't have cancer and this person nagkaka-cancer? It's because this person na may cancer, immune system niya is weak. Hindi nakaka-fight against cancer. I'll show you some slide later on na meron pati cancer ina-atake ng white blood cell. So kaya ng katawan natin labanan ng cancer. It's just that sometimes your immune system cannot recognize it. That's why hindi niya ina-atake. So ito ngayon yung immune system. Para unsa man ang immune system? Depensa sa unsa. Kagaw, no? Infection is one. Infection, viruses, bacteria, fungal, and even cancer cells. Our immune system can fight cancer at that. So, unsa man atong part sa immune system nato? We have the tonsils. Yun pala nagtotonsillitis tayo. Natural defense pala ng katawan natin yun against infection. Meron kang nakain na dumi. That's why your tonsils get enlarged to filter the bacteria. Even the lymph nodes in the neck, mga lusay-lusay na rin sa liog. Kaya sometimes even catching cough and colds, lumalaki yung lusay mo dito. Yung mga bata, maraming lusay dito sa likod. Kung sa mana. Very good. Doktor ka. Ayun, doktor. Primary complex is lymph node enlargement dito sa likod ng mga bata. They are exposed to TB. That's why a lot of children has, you're not a Filipino if you're not exposed to TB. Ano pa yung mga lymph nodes natin dito? Pati dito sa appendix. No? Appendix is one of our lymphatic system, even the spleen. So the most important cell actually of our lymphatic system, ang gusto ko lang matandaan ninyo, never mind all these things, this one, NK cell. What is that? Natural killer cell. So just remember this, natural killer cell. Yan yung pinaka-importanting cell sa immune system. And I'll be talking about this later on. Sample, cartoon figure lang ito. Ito yung white blood cell natin, or our immune cell, which we call the macrophage. Ito yung cancer cell. Ang gagawin ng white blood cell, or our immune cell, is to eat it. The medical term is phagocytosis. No? Kakainin niya. Pag nilamon niya yan, tinunaw niya, he digested it, and what happens are just the antigen of that cancer cell. Ito yung naiwan doon. And this antigen will be presented into the receptor and present it. Balik, kumbaga, flag niya yan. I have won the war. This is my trophy. Ito yung trophy niya, pinipresent niya dyan. This actually will be shared into the other cell. Paano kung siya lang nakakaalam yan? Kailangan i-share niya sa ibang cell para yung ibang cell mag-attack dun sa cancer cell. This antigen will be presented into that receptor site so that it will be shared to the other inactive o yung ibang cell na hindi pa nakakaalam na yung cancer cell dapat pala i-attack. Do you know why cancer cell keeps on growing and growing? Hindi lumiliit. A cancer cell is an immortal cell. There's something wrong with the genetics actually. They just keep on multiplying and multiplying. They are immortal. They do not die and yet they multiply very fast. Kaya laki ng laki. Then what happens, hindi sila namamatay, hindi pa sila lumiliit, hindi pa sila inaatake ng immune cell because they are not recognized by the immune system. The immune system thinks that these cancer cells are our body's own cell. Actually, they are our body's own cell. Cell man natin galing sa katawan yan. It so happens it is not recognized by the immune system, that's why it is not attacked. But if once it is attacked, it is recognized, this antigen will be presented in the receptor and it will be shared to the other inactive cell. The information is shared. Once shared, they release the cytokines. Actually, itong cytokines na to, yan yung transfer factor. This is the information code which will be shared to the other cell. They now have the information. Once they have the information, they will be also shared, they multiply and share to the other cells. They can now attack and recognize the cancer cell. That's how a WBC, a cytotoxic T cell, attacks a cancer cell. Okay? They will also present an enzyme which we call perforins. The perforins will perforate the cell wall and cancer cell, they die. They die by apoptosis or programmed cell death. Then they can now attack another cancer cell. Cartoon lang yan. Sa totoo, ito yung picture ngayon. Here is a cytotoxic T lymphocyte attacking a cancer cell. Ito yung cancer cell. Actual ito ha. Malaki yung cancer cell. Here's a cytotoxic T lymphocyte. It secretes all those perforin enzyme. It perforates the cancer cell, and the cancer cell shrinks. Namamatay yung cancer cell. That's the way a body should attack cancer cell. Unfortunately, sabi ko, hindi nare-recognize ng immune cell yung cancer. Bakit kaya? Kasi nga, ang akala ng immune system, cancer cell is our natural own cell. It needs the information. So where should we get that information to tell the immune system to attack the cancer cell? Tatlong beses na yun. Okay. So in a military model, the transfer factor, I was pointing about it, is an information molecule that teaches the immune system, tinuturo niya dun sa immune system, how to see, recognize the threats and things that become disease in our body, such as cancer or infection, and directs the immune system soldier to attack and kill it. Kahit na infection yun or bacteria, kaya pa rin niya labanan. Mas mabilis niya ma-recognize. Kagaya nito, infection ito. This infection is what you call Trichomonas vaginalis, a very common protozoa that causes UTI sa mga babae yan. Ito yung mga Trichomonas vaginalis. These are flagellates. They move around. And here is your WBC attacking. Sinusundan talaga niya. Pag lumalapit doon, nilulusaw niya yung Trichomonas vaginalis. So infection is better controlled if you have the transfer factor to help it recognize and kill the infecting organism. Kaya yung sino ba dyan frequent ang UTI, nakailang antibiotic na kayo? Una, trimethoprim sulfonetoxazole, naging quinolone, naging cefuroxime, ano pa ba yung mamahaling pag-UTI na gamot? Halos lahat, oral, hindi niya kaya, injectable na. You try to add transfer factor to it. No? I've tried it on my patient, mas mabilis ang control ng UTI. It's because your immune system is now working. It's not only the antibiotic. Alam niyo ba sa antibiotic, there's such a thing as resistance.
Yes.
Once you always take that antibiotic, the organism or the bacteria will now know, uy, yun pala yung antibiotic na tinitake mo ha. Afterwards, you take that antibiotic, hindi na gumagaling. It's because it's already resistant. But transfer factor, it actually educates your immune system, and your immune system will attack it. There's no such a thing as resistance there. So actually, transfer factor was discovered by this old man. His name was Dr. Sherwood Lawrence in 1949. During that time, ang prevalent to na parang cancer is TB. Pag may TB ka, parang may cancer ka na, no? Because there's no known cure. Ngayon pala, ang gamot lang tabletas na lang. No? Sana later on, ang gamot din ng cancer, tabletas na lang. Actually, they're coming out with it, no? Cancer cure in the form of capsule. But it's still very expensive. It will cost almost 500,000 a month just for that one batch of capsule. The newer drug now against capsule, it's almost 500,000 a month. Capsule na lang, very effective, very specific, less side effect, but very expensive. Kasi bago pa siya. But sooner or later, when it becomes more common, or the patent is already off patent, magiging mura na yan siya. Because it's very expensive to discover a drug. Once they discover it, it would take millions of dollars. That's why they have to recover their investment also, kaya ang mahal. So this old man was making that discovery, ano kayang cure against TB? So what he did was actually supposing, may mukhang TB hunter. Kunyari kayo, may TB kayo, no? You have TB, tuberculosis, and you get the blood, extract the, sa blood kasi mayroong red blood cell, white blood cell, and the plasma. Yung white blood cell lang ang kinuha niya. He extracted the white blood cell, and then wash it, then inject it to this person na hindi pa exposed sa TB. So yung white blood cell, kinuha dito siya sa pasyente na may TB, and inject it to this person na wala pang TB. And he noticed that after injecting this person with the white blood